let me tell you true life stories. The first story. A woman feels perfectly fine. No pain, no warning, no symptoms. She almost keeps her routine mammogram, but she goes, even though half-heartedly. They find something small. It is at stage 1. It's localized. It is contained. Surgery, then short recovery, no spread. Today, she's alive, she's thriving, she's healthy. The second story. Another woman feels she's fine. She skips her screening. Months pass. Then she gets tired. Then pain. Then the testing. She has stage 4 cancer. It has spread. Now the words change. Aggressive treatment, complex therapy, uncertainty, same disease, different timing. And timing changes everything. Today, we are talking about how early screening beats late treatment. Not emotionally, not politically, but biologically and statistically. Hi, I'm Dr. Joshua Derito. I am a family physician. I have interest in public health and cancer prevention and treatment. Here, we change complex science into simple things that you can use today to improve your health. The earlier we detect cancer, the simpler it is to treat, and the better the outcome. Data from 2025-2026 is very clear than ever. Let's break this down. What is cancer screening? Now, one of my friends told me that when you go for screening, you are looking for cancer. And why should you look for it? Do you still believe that? Screening means looking for cancer before symptoms appear. Why should you do this? You are feeling healthy, but you check anyway. Why should you do this? Now, you do a mammogram for breast cancer. You do a HPV test or a pap smear or a FIA for cervical cancer. Then you do a colonoscopy or a knockout blood in your stool long before colorectal cancer shows symptoms. You do a low dose CT scan to check for possibility of lung cancer. You do a PSA to test if you could be having prostate cancer. And this is usually shared decision making for men. So screening does two powerful things. It finds cancer early. And in some cases, it prevents cancer completely, entirely. How does this happen? If you detect abnormal cervical cancer changes long before any appearance of cancer, then you are able to prevent yourself getting cervical cancer. And remember, overt cervical cancer will come 10 years after you had the cervical cell changes. So you have the capacity to change the scenario. You have the capacity to prevent yourself getting cervical cancer. And I have seen it with some patients who do a pap smear, you get abnormal cells, they are removed, and that chapter is closed. I've also seen people who have dread screening, they present with stage 4 cervical cancer. Let's look at a colonoscopy. You do a colonoscopy to check for the presence of polyps in your large colon. Many times patients do this, they don't find anything. But when you find polyps, they are removed. These are benign. Benign means they have no symptoms of cancer, and they can be removed long before they change to cancerous lesions. And that is prevention. You cut the cancer before it forms. So that is what justifies doing screenings. You are able to prevent many people getting cancer before it appears. So that's what prevention is. Let's look at the survivor gap. Now let's look at the real numbers. The breast cancer. Localized breast cancer, when detected early, 99 to 100%, almost 100% of people will live 5 years without serious complication. When it is stage 4, only 32 to 33% of the people will live to 5 years. That's not a small difference. The difference between cure and the chronic disease management is time. For colorectal cancer, when it is localized, when you remove the polyps, 95% survive 5 years. When it has gone to other parts of the body, only 13% live 5 years. This is not fear-mongering, it is science. Cervical cancer. Where screening programs are strong, deaths have dropped by 50 to 70% or more over the decades. And that's where we want to be, and we can be able to get there. So these are not theoretical improvements. These are lives changed. So if you are a lady, you are between the age of 21 to 65, please, this is the time to do your VIA. This is the time to do your pap smear. Don't wait for symptoms. These can change your life. It can change the way you live in your later years. Survival is not just about living. It is also about the quality of life that you have. Why does timing change the biology? Cancer grows. It spreads. It invades nearby tissues. Then it goes to distant organs. The earlier we interrupt that cycle, the fewer cells involved. Then the fewer the mutations that have accumulated. And also the fewer the symptoms, the systems of your body that are affected. So, early cancer often requires limited surgery. Sometimes it may not even require chemotherapy. It needs shorter recovery. Late stage cancer requires multi-drug chemotherapy, radiation, long-term systemic therapy, and even higher toxicity of the drugs. If seen patients celebrate decades with their family when they are diagnosed early, and it has also shown that you have different journeys when you catch it late. This is not fear messaging, please. It is biology. It is the reality. What is the impact on the population of these statistics? When screening programs increase, mortality decreases. Colorectal cancer deaths have fallen significantly in countries with routine screening. Cervical cancer plummets where human papillomavirus testing and pap smears are not accessible. Breast cancer survival improves when mammogram uptake improves. The World Health Organization prioritizes early detection as a cornerstone for cancer control globally. Screening is not just personal responsibility. It is public health protection. Public health protection. So let's address the screening concerns. Sometimes screening might not be perfect, but there are still discussion about false positives of a diagnosis, lead time bias. But the truth time, lead time bias means finding cancer earlier may appear like to extend survival time without truly changing the death outcomes. But here is the key. Large population studies have shown that there is real mortality reduction. It is not just earlier reduction. So, fewer people will die from the cancer. It's not just living longer after diagnosis. And modern screening guidelines, they are built carefully to balance benefit and harm. And they evolve as the evidence improves. So that's why they are guideline-based guidelines, and that's why they are individualized, especially for cancers like prostate. You need to have a personal discussion with the men and also decide who qualifies for the screening and what screening. So who should be screened? Current guidelines, and always personalized with your doctor and your health provider. For breast cancer, mammograms start at the age of 40 to 45, and they can be done annually or biannually depending on the guideline and also the risk of the person. Cervical cancer and the human papillomavirus screening from the age of 25 to 64. For colorectal cancer, start colonoscopies at the age of 45. For lung cancer, if you have been a heavy smoker, start with the low-dose CT scans between the ages of 50 and 80. For prostate cancer, it is what we call shared decision making, especially from the age of 45 to 50, and depends on your family risk. Guidelines continue to evolve. These factors and family history matter, but silence is never protective. Conversation is. Talk with your health provider. So early detection means you have more options. You have less aggressive treatment. You have lower cost. You have less suffering. You have more healthy birthdays to celebrate, more graduations, more quiet time in the evenings with your family. So screening is not panic. It is preparation. It is choosing knowledge. It is choosing timing in your favor. Imagine two doors. One says check early. The other says wait for symptoms. One gives you options. The other gives you urgency. Early screening does not create disease. It creates choice, and choice saves lives. If this message matters for you, comment screen. Know what is your age appropriate screening that you are due for. and go for it. If you want more personalized conversation, call us on our numbers, or visit the Wellness Health Services Medical Center, or you can call us and you can follow us at the Wellness Health Services website, and you can book a call or you can book an appointment. Share this with someone who is keeping postponing his checkups. And if you want cancer screening checklist for age and group category, comment set checklist. I will drop it for you. Prevention is power. Early detection is protection. And timing changes everything. I'm Dr. Derito. Thank you for watching. We meet in the next video.